And is both a clinical therapist and a parapsychologist. When somebody comes to you with a story, when they tell you something, it certainly helps being an expert on human behavior, I would imagine. How long does it take you to sniff out if it's some kind of a psychosis or if these folks are legit and really asking or telling you a legitimate story?
It's actually not as easy to parcel out psychosis as some people think. We go about our days assuming that we can pick out someone who is actively psychotic or schizoaffective or schizophrenic or has mania or disorganized thoughts or religious preoccupation, or we think we can do that, but there's a lot of people that schizophrenics that are very good at masking it. They know if I say this, people are going to look at me weird, right? So, and a lot of people with schizophrenia are very high functioning people in the society, from physicians to lawyers to therapists to uh, you know um, probably on in politics as well. So people with schizophrenia are all around, and they're very high
All of them.
functioning. Yeah, they're very high functioning. They're very intelligent. People with bipolar, who have episodes of mania, they're all around us. So this idea that we could spot psychosis from a mile away is not necessarily true. Sometimes when it's highly intense and acute, obviously you can. If you sit in a room with somebody for an hour, you're probably going to pick out some delusions. You're probably going to pick out some things that just don't seem right. They seem irrational or disorganized thinking. So, maybe sitting with somebody for an hour, you'll be able to probably pick it apart if you're experienced in finding these things and asking the right questions. But it's not that easy. When people have these ghostly stories all the time. When I go to conferences or paranormal conventions, when people come up to me and start talking about their experiences, um, it can start very small, such as a sense presence, and then turn into demons. You start off with, there was a sense presence in my house, and then 15 minutes later, you know, demons are in my closet. So it can go from something small to something really intense. Um, but it's not as easy as people think. I think obviously those trained in it are better at picking that out. But with clinical parapsychology and with regular clinical counseling, it's important to know what to look for. But not all people who have ghostly stories are crazy or schizophrenic or delusional or anything like that. It's actually a lot of people, a majority of people who have these ghostly phenomenon don't score high in these sort of personality tests which determine psychosis or schizotypal personality disorder. People with ghosts don't really have those sort of critical thinking errors that I think a lot of people presume that they have. That's just sort of kind of a myth that's been put out there, unfortunately.